And I would like to introduce you to our session today, Fostering Hope in the Chaos of Reentry, with Dr. Roxanne Coey, who is the Assistant Deputy Director of the Office of Reentry. I just have a couple housekeeping things to talk about before we get started today. Please make sure that your camera is disabled during the presentation and have your microphone on mute. We would like you to use the chat feature today to ask questions, and we will be stopping in between to answer all questions, so we will make sure to get to them. And if we don't, we will make sure that we follow up with you. Again, just a reminder that the recording will be posted on the Building Bridges YouTube channel. Dr. Coy, would you like to go?
All right. Good morning, Michelle, and thank you. And good morning, everybody. And thank you so much for joining the workshop today. As Michelle said, I'm Roxanne Coey. I am in the ODRC Office of Reentry. And I just wanted to tell you a little bit, if you're not familiar with DRC Office of Reentry, a little bit of how we're made up. We have 8 reentry coordinators throughout the state that work with returning restored men and women, reentry coalitions, correctional institutions, adult parole authority, to help the men and women in their transition back to communities. We also have a reentry administrator that specializes in housing, a reentry administrator in the North region, South region, and all of us are under the direction of Deputy Director Ronnie Burks. So as I begin today, I hope to make this as interactive as possible. Please feel free to share comments, questions in the chat throughout the workshop. Okay, and we will get started. One of the things that we are required to operate within in ODRC are our 4 core values. Our director, Annette Chambers-Smith, when she came to DRC as the director, these are things, the core values that she implemented. So take care of our staff and they will transform our offenders. Civility towards all, one team, one purpose, and hope as job one. And hope has already been emphasized this morning. And this is mission critical to the work that we do. And honestly, the work we're all doing to providing hope, helping people keep hope as they come home. So we continue to follow that. And we strive to continue hope throughout the reentry process with everyone. So a few things. The ODRC mission is to reduce recidivism among those we touch, and our vision is to reduce crime in Ohio. Now, the Office of Reentry, we have a mission that operates within the mission and vision of the larger department of ODRC. The Office of Reentry mission is to connect. We connect individuals with communities, programs, and services. And the Office of Reentry vision is to facilitate successful reintegration for individuals. Okay, so I just wanted to provide a few bits of information about ODRC, and this information can be found on our website in our annual report. But currently, fiscal year 2024, total population within ODRC is 45,284. We have in this annual report, it's says we have 41,661 men, 3,623 incarcerated women, and we in calendar year 2023 we released over 18,000 people from custody. And I thought these last 2 pieces of information were really important, particularly for people that are new to reentry or wanting to get into the arena. The top 2 commitment groups by age are 30 to 34 and 35 to 39. So the largest population is that 30 to 40 age group. In the average sentence is 2.6 years. Now that varies. Some people serve less. Some people serve considerably more. But again, that's the average sentence. So here's where I want you all to jump in the chat. And I can't see the chat, Michelle, so I'm going to try to look at it. But can someone define reentry for me? Or tell me, why does reentry matter? Give that a few moments to see what kind of comments we get.
Hey, Roxanne, while we're doing that, you're showing all of your slides. Are you able to just click on one of the icons below your slide to switch to view?
Let me see. That didn't work, did it? Slideshow.
There you go.
How's
Thanks.
that?
Yep.
That worked?
Yeah, you need to be in slideshow mode. Yes.
I thought
Okay,
I
we're
missed.
getting services for persons returning into the community after incarceration or separation of some kind. Set up for success. To give services and hope to our returning citizens. Restored citizens working to live in freedom and good choices. Transitioning back to community. Coming home from incarceration. We got a lot of them. You want me to go through all of them, Roxanne?
Just a few more, if you wouldn't
Okay.
mind.
People need community and people to believe in them. It matters greatly to prevent recidivism. Coming home from being incarcerated.
Nice. Okay. Can you see my right screen now?
No.
No. Sorry, folks. I thought I signed in early too.
Roxanne, that looks great to me, the way you have it right now.
It
Yep.
does? Okay.
Mhm.
Thank you, Jen. Okay. All right. So great. This, thank you. Thank you all. Why does reentry matter? Michelle, were there any comments in there about that? Foster hope, I heard, right?
Yep, foster hope. Reentry from someone who has done it is most simply put as becoming a part of the world again, a productive and successful part.
I love that.
Reentry is the process of returning to society after being incarcerated.
Right, right. I love that, folks. Thanks. Thanks for your comments and input. There we go. So just to keep things simple, what is reentry? Reentry is complicated and a dynamic process. So for those not familiar with reentry, it's important to remember that reentry is not an event. I always say this, my team's probably sick and tired of me saying this, but reentry really is a process. It's an ongoing process. And sometimes it's not a linear process. Sometimes it's a crooked line for folks. It can be complicated by the pressure to chase multiple things simultaneously. There can also be multiple dynamics that impact reentry. You know, how long the person was incarcerated, their age when released, um, you know, what resources they have access to, you know, housing, transportation, addiction, social support, employment. These are all just a few of the things that can impact reentry. But I really want to take a look at the next slide, where we'll talk about the chaos of reentry. All right, so this is a little illustration that we utilize. This person running on the wheel is someone who is coming home from incarceration, and they're racing. They're racing. They get a whole bunch of things done, but there's a lot of pressure. It's a lot of pressure coming at people. Sometimes you have a parole officer. Hey, you need to be in my office. If there's substance abuse issues, did you go to treatment? Did you go to your meeting? Are you going to test positive? Social services, I made an appointment for you. Why didn't you show up? Your employer, why are you always late? You didn't even show up yesterday. Your family saying, gosh, you haven't changed. You're still showing the same behaviors. Your children sometimes are like, when are you going to spend time with me? We miss you. We miss you. When are you going to spend time? Landlords are saying, hey, the rent's due. Where's the rent money? And then your friends are saying, man, you've changed. You're not the same. There's a whole lot of pressure that surrounds men and women coming home from incarceration. And whilst all these things don't apply to every person, I think it's fair to say that every person that I've spoken to that's encountered and going through reentry has experienced at least some of this in partial ways. So how can we assist? How can we assist the formerly incarcerated? There's some easy answers. What are some easy answers that I would like to see in the chat? What do you think is the way we can assist the formerly incarcerated?
While we're waiting for that, Roxanne, I just want to, a note from someone. One of the biggest challenges is ourselves and overcoming the faulty belief that the world does not want us to be a part of it. It matters to everyone. Recidivism is a burden, not only to the individual, but to society as a whole. Successful reentry turns a burden into a blessing.
I love it. Oh, I'm really happy with the people who are commenting. Thank you so much. I appreciate that.
Okay, some of our answers coming in are positive interactions,
Nice.
referrals to community resources,
Okay.
send them a referral to their county citizen circle,
Okay.
job search, housing, and transportation, advocate for them, respect them, meet them where they're at,
I love it.
help them with resources and set them up for success, not wait till they are released.
Yep.
Help schedule appointments such as substance abuse treatment, mental health, job and family services.
Mm-hmm.
We can assist with resources, housing, employment, reducing stigmas, link to resources, speaking freely, being patient, many more. Would you like me to keep going?
No, these are great.
Okay.
These are great. I get it. Awesome. Okay. So I love the answers because really, I think this workshop is for all of us. Again, some of you may be very experienced in reentry. Some of you are just trying to jump in the arena and say, hey, what can I do? So how can you, meaning all of us, assist the formerly incarcerated? And I've kind of really narrowed this down. I didn't want this to be like, book work. But I think there's three big things that we all can do to help formerly incarcerated men and women just transition. One, eliminate the stigma. Two, help individuals realize their possibilities and walk this journey with them. I added this picture, and I hope you guys can see this picture really well. Some of us are in there, but the point of this picture is these are some folks from the Small Business Administration. It's a federal agency. And just to illustrate the work that they are doing, they are incorporating all three of these steps. They are eliminating the stigma by including incarcerated men and women in the education of what the SBA does. And all of their services are free of charge. Two, they are helping incarcerated persons know that the idea of starting a viable business really is a possibility for them. And three, they are walking this journey. They're walking the journey with those interested in starting a business and assisting them, bringing their ideas to life and helping them get their business started. So they have been, for 2 years now, they have been conducting classes in various correctional institutions throughout the state. So these guys are wonderful. And I hope that you get an opportunity to engage them in some way with someone that you're working with to start a small business, because they are just phenomenal. So I wanted to use them as an illustration. So, but let's talk about eliminating the stigma. What does that do? We need to help the formerly incarcerated believe that their past behavior does not define them. Okay. This is not always a specific event. Like eliminating the stigma takes time. It's a gradual, progressive process. And I like this comment from Ecclesiastes. It reads, there's a time to search and a time to give something up as lost, a time to keep and a time to throw away. And I think that as we walk this journey and help restored men and women, we can help them throw stuff away that they no longer need, and help them figure out what to keep if they need that help. Some are very clear. Help remove barriers when possible. I think those are some of the comments that we got already, and not viewing the person as someone to be feared. Okay, so I mean, almost none of us can change our thoughts and behaviors immediately, even though we may want to. Change takes time, and I think a positive voice helps men and women realize that to give something up, throwing things that are harmful away is okay. Men and women who have been incarcerated, they experience many blocks to reintegrating into their community. Stigma is created by these barriers. The inability to obtain safe and affordable housing. There's employment restrictions for so many people. There's accrued debt prior to incarceration. And sometimes there's accrued debt from incarceration, court costs, fees, and fines. Tom talked earlier in the opening session about what Judge Coleman is doing in Lucas County. I mean, these debts can just really cripple people for a long time financially. If you're an employer, what are some ways that we all can help? If you're an employer, you can give somebody the opportunity for employment. If you rent houses or apartments, you can give someone an opportunity for safe, affordable housing. And I think it's very important that we look at the person as a new person and give people room and time to work on the changes that they wish to engage in. Help people realize the possibilities. Life after incarceration can and often does have new meaning. Help men and women understand reentry is a journey. A prison sentence doesn't have to be a life sentence, but some of the collateral consequences of incarceration makes it feel like a life sentence for a lot of men and women. And many men and women coming home are not aware or comfortable with accepting help. And there are many agencies and individuals throughout Ohio that can assist. And I wanted to put this picture on here. This is a picture of a woman who was incarcerated. And Ronnie talked earlier this morning about people being able to work during incarceration for outside agencies. This woman worked at an outside agency, and this was a picture of her opening her paycheck. And I wasn't there. I don't know the complete story, but the expression on her face tells the story. So this woman is doing a real job, making real money, and helping to, make her transition easier when she comes home. Walk the journey with them. I think I skipped one, didn't I? Help realize the possibility. No, I did that. Okay. Walk the journey with them. Social support and encouragement are critical. I will be bold in stating that reentry primarily is about relationships and trust. Establishing trust is twofold and requires both parties to engage in this. Provide an opportunity to engage in something meaningful. Reentry coalitions and collaborative partners are located throughout the state. For most of you, those of you wanting to get in the arena to assist returning citizens, please know that most of the engagement is about social support of an individual. There are agencies, people, reentry coalitions throughout Ohio that know how to assist. You don't have to do reentry, but being supportive in the reentry process is significant. Some of the comments were like, don't judge me, help me make appointments. These are all things that we can do to support men and women. It's also important to know that many individuals have more than one issue they may need help with. For many of those returning, they had a strong support system while incarcerated, but leaving incarceration, they've lost that support system. Their release removes them from those supports that they built and are now in need of support and encouragement out here. This work is about meaning making for the individual that you're serving and assisting, and for yourself and for the community. So I feel like everybody wins when we assist men and women with reentry and being that supportive person. Okay, what are some of the resources available? We have reentry coalitions and citizen circles. Someone mentioned citizen circles earlier in the chat. And I think Ronnie mentioned reentry coalitions earlier this morning too. So for folks who don't know, reentry coalitions are collaborative groups of agencies, companies that assist men and women who are coming home from incarceration. Incarceration could be jail, halfway house, prison. It doesn't matter. They will help people get the things that they need. Oftentimes, it's basic needs like hygiene, documentation like birth certificate, driver's license. But then, there's people who, as they get further in their reentry, they do need help with housing. They do need help with employment, or may need they have an opportunity for a promotion, but need some more equipment or need a class or things like that. So reentry coalitions are amazing, and they're throughout all of Ohio. We have 63 counties of the 88 counties now that are in which coalitions represent the resources and agencies in those counties. So 63, we're almost there. We just have 25 more to go, which is a lot further than we were, 2 years ago, Michelle, right? And citizen circles, they provide assistance. And I think that the difference between coalitions and citizen circles is that citizen circles provide a more individualized, in-depth assistance to men and women returning home. And so there's not as many citizen circles throughout Ohio, but I put our website on here so that you can have access to where the coalitions are and where the citizen circles are located. And I think that how we differentiate citizen circles, we encourage people to make referrals for citizen circles for people who may have served a very long sentence or have multiple big issues that they're really trying to reconcile coming home, or someone who is being released to an area that they're not from. There's a new area where there's more opportunity, more resources for them, and the citizen circles can really help people get acclimated to the new community in which they're going to be a part. So, do we have any questions so far, Michelle?
We don't have any questions. We have just a lot of comments on what had been said.
Okay.
And I actually have a question for you, if you
Okay.
don't mind.
No, I don't mind.
So, how can we assist families with the transition, especially when they don't have a good relationship, maybe with their loved one who's incarcerated? And this brings to mind the situation at one of our family events a few months ago with the grandmother who was watching her daughter's children. If you don't mind talking about that.
Yeah, absolutely. Absolutely. We have a few things that I think are helpful to families. We have our director, Annette Chambers-Smith, restarted the Family Advisory Council in 2019. So we have a council made up of primarily family members of incarcerated or formerly incarcerated loved ones. And so they really give us a lot of good feedback about what families need, what families are experiencing during their loved ones' incarceration. So they have they tell us what they need. They tell us what is not working. And it's been really a wonderful relationship. And I think more applicable throughout Ohio is that the Office of Reentry has what we call community-based family forums throughout the state. And I mentioned earlier the 8 reentry coordinators that are located throughout Ohio. Each reentry coordinator hosts community-based family forums for family members. And we have resources, we have correctional institution staff, we have reentry staff at those events to give families, I think first and foremost, access when they're not in regular contact with their loved one or don't know what resources are available when their loved one comes home. These family forums give people access to get information, to ask questions, to really maybe really help dispel a lot of the myths that that families have about incarceration and reentry when they come home. So what's today's date? The 16th. I think our next community-based family forum is going to be the 29th in Lucas County. And you can reach out to our office and we can give you a schedule. Michelle, am I missing one? Is there one next week?
Let me check.
Okay, okay. But we can send you the information. And these are ongoing. It's not one and done. And we try to have them in various areas of Ohio. It's not just the big areas. We're working on scheduling one November 7th in Huron County in New London. So, yeah, if you want to reach out to, Office of Reentry, we can give you all that information if you're able to make a community-based family forum. And then the other thing that we've incorporated for not only our incarcerated population, but this is a resource for families also. I don't know if many of you are familiar with relink.org, but I put this QR code on the screen. So I'm hoping a lot of you have your cell phone. You can take a look at that QR code. It's going to take you to the Relink website. And we started working with Relink, I think maybe around 2018 or 19. And they it's a resource. It's a resource for online resource for Ohioans to let them know where things are, what resources are available in their community. And when we started working with Relink, we're talking to them about how important this would be for the reentry population. They added a reentry dashboard to their website. And so if you're looking for housing, clothing, employment, food banks, anything like that, Relink has that information on their website. And I think what's great about Relink, this isn't just a resource that's online and it's usually, outdated in a week or so. The partners that are on Relink, they can change their information. So if their hours of operation change, if the person, the contact changes, folks have the ability to go on there and update their information. And on the other side of that is that Relink is consistently double checking, making sure that these agencies are still in operation, that the information is still correct. So we believe that this information is as up to date as possible. So Relink is also a resource for families. Excuse me. And then I think specifically for families, if you don't have a good relationship with your incarcerated loved one, you can always call the Office of Reentry and we can try to answer questions that you may have or put you in contact with the people that can assist you. Did I answer all those questions, Michelle, or are there more?
No, I'll get to a couple comments. We did, thank you, Ronnie, for dropping in the chat, the Toledo family event.
Nice.
But we do have, that is on October 29th. We have another one on November 12th at the Athens County Community Care and Resource Center in Nelsonville. And then some of the comments that we had, let's see here. We have many who have done a lot of time with major anxiety about leaving.
Yeah.
They really need a connection.
Okay.
Some of the grandmothers who have cared for their children have a very hard time returning care to the released parents.
Okay.
Yeah.
Those are two big ones. Let's talk
Yeah.
about this real quick. Okay, Michelle.
Yeah.
So the first one, many who have done a lot of time need a connection. If your loved one is getting ready for parole or served a very, very long sentence, please feel free to reach out to us. One of the things that the Office of Reentry began doing, of course, during COVID changed a lot of our practices, but some of them we are just keeping because they really worked out well. So if you have a loved one that is nervous and having some anxiety about coming home, feel free to call our office. What we try to do is we meet with your loved one, sometimes in person, sometimes through their case manager on like a Teams call, like virtually. We'll meet with them and talk to them, get to know them, and figure out what they believe that their needs are for when they coming home. What are your anxieties? What gaps are there in your reentry planning? Has this been communicated? We will try to really help that person adjust to not only thinking about coming home, but coming home. A few of the ones that we've done, we've had long-term folks getting ready to come home. And what was nice about that is the very first one I did, we brought the person's family members on the call too. And what was really nice is that at the beginning of the call, it was a gentleman being released and three of his sisters, and he was going to be released to one of his sisters. The three sisters were able to talk to their brother about coming home, how excited they were that he was coming home. And it was nice to see them interaction, to see them excited about their family being together again. But after that, we were really able to talk about the expectations that each of them had, what he expected and what he believed he would need coming home. And then the sister he was going to be living with, she was able to, really just provide, hey, I have an apartment, I have an extra bedroom here. He's more than welcome. And she talked about, her work schedule and things that she expected too. So it was really nice that we were able to have those conversations. So if you do have a loved one or working with somebody who is having some anxiety about coming home, we can try to make those connections and help them. Grandmas being concerned about immediately giving their children back. Am I understanding that question correctly, Michelle?
I will reread it. Some of the grandmothers who have cared for the children have a very hard time returning care to the released parents.
Wow. Yes. It's not the first time I've heard that. I don't have any coined comments to that or for that. However, again, I would encourage grandmas who are concerned about that, anybody concerned about that, again, can contact us in the Office of Reentry. We can help connect you with folks. We can help you and your loved one make a plan. Like, what are your expectations that you want to see that would make you feel comfortable giving the children back? And maybe that's a progressive thing and not an instant, automatic thing. So I don't have a coined answer to that one because those situations are so individual and dynamic. I think that it would be a disservice to just say, oh, do this and we could do this. So I would just encourage grandmas to reach out to us, please. And we will help in any way that we can. Any comments?
Another question from our friend Michelle Tile over at Belmont.
Hey, Michelle.
She had said another issue is that they are not knowing where they are going until so close to the door, which causes even more trauma. I
Yeah.
don't think it can be changed due to bed availability, good days, policy, but what kind of tools can we use to lighten this anxiety and burden? And I think, I think you answered it about virtual meetings, but if you have something else to add, let me know. But then we did have a response from a restored citizen that said this is very true. I was so blessed to have had Lisa Morgan
Oh,
in the Office
nice.
of Reentry refer me to sober living program. He's now managing the house, and it changed everything for him after many failed attempts.
Awesome. I appreciate that comment and thank you for sharing. To get to Michelle's question, I think, Michelle and any folks that are in the institution, we really are pushing that the incarcerated population use Relink, and we're trying to encourage them to have, when they submit release plans, to have 4 release plans, and look at Relink. And we want to empower the men and women to go to a place that's going to be beneficial and helpful to them. We don't want them to just be placed here or placed in a halfway house or play if that's not what's best for them. So I encourage the population to really comb Relink for possible placements upon release. Look at the agencies that have housing or sober living or anything that you think you would need. Talk to your case managers about that. Case managers, don't be afraid to ask an individual, hey, what have you found on Relink? What is going to fit your needs? I don't know that we can actually fix that problem. I know a lot of folks, they want to go home, but sometimes home is not approved. So I just really encourage them to really take a look at all the possibilities. I guess, first choice, second choice, third choice, when they're planning. And if they, again, Michelle, if they need help, we, Office of Reentry, we can assist. I keep saying we can assist, and we want to. I don't want the audience to think that I'm just saying that. Oh, just give us a call. We want to assist. We want people to have stability when they come home. We want them to have social support, and any support, sobriety support, any support that they need coming home. Our mission is to connect individuals with resources, programs, and programs in their community. So that's what we aim to do. Okay, anything else, Michelle?
Yeah, we have a question from Wendy Tarr. Does ODRC help connect people with information on peer support? Peer support is also a service that is able to be included in the new Medicaid 1115 waiver, and it is the state, and if the state will include it, that would be helpful. Also, she said, I assume people can also access it on Relink, but it is good for the case managers to encourage people in that direction.
It is good. And I know we are increasing the peer support in ODRC. Some of our incarcerated population are becoming peer supporters. Actually, Wendy, I want to write that down and follow up with you. What was the form number again, Michelle?
The 1115 reentry waiver. I'm going to talk about it in our Columbus meeting tomorrow, but it
Awesome.
would be billable services to Medicaid prior to release that the state's applying for, and there's optional things that can be included. So,
Okay. I need to
Yeah.
know more about that, Wendy. So I appreciate you.
Yeah. we can circle up later. Thanks,
Yep.
Roxanne.
Yep. Thank you. Awesome.
Jen Nail reminded us that Tuesday Talks for November is on the topic of grandparents, guardianship, and some of the complications that families go through.
Jen, would you mind posting that in the chat? So
Sure will.
thanks, Jen. I appreciate it. Thanks for bringing that up. I totally forgot about that. That's great. All right. Michelle, I think I'm going to move on unless there's more comments.
Yeah, why don't you go ahead? I'm trying to catch up over here.
Okay. All right. So there we go. I already talked a little bit about the community-based family forums. These are some pictures from the forums and the picture on the left. This was a gentleman who was going to an agency and he happened to be at the family forum that night and asked if he could talk. He wanted to talk about his experiences with the agency that had hosted the family forum. And if I remember correctly, Michelle, he said the agency saved his life. He was accepted, embraced, and just really, really assisted. And he was an amazing speaker. I would love to have him speak for us again. He was awesome. And then the picture on the right, what you see there, you see the relink table, and a table beside it. That was another family forum in Columbus where we had lots of resources there and family members that got to get resources, talk to people about how to help themselves or their loved ones when they come home. All right. Let's see. this next screen, I've talked about Relink a little bit, and I just wanted to share, what is the population? They're incarcerated. What are they looking for on Relink? Are they using it? Yes, they are using it. And I'm so happy. We've had, oh gosh, a few months ago, it's been well over 1 million views on Relink. So what are they looking for? They're looking for felony-friendly housing. They're looking for general reentry support. Unfortunately, they're looking for food pantries, workforce development, employers, financial assistance, addiction resources, clothing, mental health assistance, reentry, halfway housing, job training. And again, unfortunately, we've had almost 13,000 views on homeless shelters. So I wanted to share this snapshot so you would know what the ODRC population is looking for upon coming home. So if you are wanting to get into reentry, these are some of the things that people are needing. Michelle, any more comments? I just have one slide left.
I just want to point out for everyone to check the chat. There's a couple different discussions about sober living that is available from some of our community partners. So please look at the chat for that. And
if I can address that, if our partners, our reentry partners posting on there, please, I want to encourage everyone to make sure you're on Relink. And when you create your Relink profile, really make your profile robust and list all the services that you offer, so that your agency pops up in multiple searches for individuals. So if you're not on Relink, I encourage you to get on Relink. And if you need help with that, you can call Relink. They will walk you through the process. It's really quite easy to do. Okay, so this last slide, I found this article. We were actually planning a Stephen's ministry training at an institution, and when we interviewed folks who wanted to be Stephen ministers for others during incarceration, a lot of people said, "Oh, I like to fix people. I just like to help. I'm a helper. I'm a fixer." And it was interesting that we had the people that were helping me facilitate that training shared this article. It's called Helping, Fixing, or Serving. Fixing and helping create a distance between people, but we cannot serve at a distance. We can only serve that to which we are profoundly connected. So helping is not a relationship between equals. Oh, I'm going to help them. A helper may see others as weaker, and people feel this inequality. Fixers trust their own expertise, but may not see the wholeness in another person. Serving makes us aware of our wholeness, and the wholeness in us serves the wholeness in others. Service is a relationship between equals. Our service strengthens us as well as others. So if you've ever heard Ronnie Burks, our deputy director, talk, she introduces herself as she gets to serve the DRC population. She gets to serve the reentry. All of us are serving the reentry population. It makes both of us whole. It puts everybody on an even plane, and it makes us all equal. So I like to share that our goal is to serve. We're not helping and we're not fixing. We are serving. We are here to serve others. And with that, if there's no questions or comments, I thank everyone for coming, and I appreciate your time today.
One other question, Roxanne, not sure if you can answer it. What is the % of individuals coming home that are in need of recovery services?
I couldn't say a percentage. I would refer you and myself to the ODRC the 2024 annual report. And I think that report will provide some of that information. I didn't put that on. I didn't look that part up, but I will. Is there a contact information? I can send them an email, Michelle.
Yep.
Okay, I will follow up with that one.
Yep.
Okay. Any other questions?
No other questions.
Okay, everyone. Michelle, thanks. Thanks for helping me with the chat. And
Absolutely.
thank you all, and I hope you enjoy the rest of the conference.